And if we start seeing an increase in infections, well, that's our reputation. And we want to make sure, at least I do, that I know what's going on and that I know what's happening in those departments. And I'm just, struggling to understand because there's a lot to know. So I'm working really hard at building my knowledge and working with my teams to get me up to speed. And how do I find this information?
Infection stops where information starts. Welcome to the Transmission Control Podcast, where knowledge is your strongest defense. Broadcasting from the front lines of healthcare, we dive into the strategies, science, and stories shaping infection prevention today. Each episode, we connect you with experts on real-world insights to help you stop the spread of healthcare-associated infections, protect patients, and strengthen your practices as an infection prevention and public health expert. When the right information reaches the right people, lives are saved.
Hello and welcome to the Transmission Control Podcast. My name is Garrett Hollenbeek. Today we're excited to talk with Trena Illingworth, Infection Prevention Program Manager at Common Spirit Health in Longmont, Colorado. We are excited to hear her experience as an epidemiologist with a public health background, kicking butt and taking names in the IP world. So we'll be right back after a brief word from our sponsors.
Brought to you from the studios of Healthcare HQ, let's get into it. This is Transmission Control.
Hello and welcome to the Transmission Control Podcast. My name is Garrett Hollenbeek, Editor-in-Chief for Transmission Control, and I'm joined with my host, Jill Holdsworth. Jill, how are you doing today?
Hey, Garrett. Doing great. Great to be back in the studio with you.
Yeah, we're excited. And I'm especially excited about this episode today because our transmission control audience, I don't know how much people know, but it's a big portion of it is infection preventionists working in clinical care settings. And then we also have a big public health audience. And today we get to talk with Trena Illingworth, who's got kind of the both sides of the coin there. She's an epidemiologist with a public health background and is manager of infection prevention for 2 hospitals out in Colorado. And so today we get to see both sides of that public health coin. So Trena, we're excited to have you on today.
Thanks. I'm excited to be here. Thanks for inviting me.
Yeah. And so just so we get to know you better and our audience gets to know you better, can you tell us a little bit about yourself and your journey into the world of IP?
Yeah, thanks. Yeah, it started with my passion for infectious diseases. I got my master's in public health and epidemiology. I graduated right before the pandemic happened, so about a year prior. I was working as an epidemiologist for local public health. Funding had been cut from the CDC. Things had changed at our state level. So I was like, what do I do if I want to continue doing infectious disease and maybe public health isn't going to work out? So I started looking into and studying for the CIC, for the certification of an infection and control. And NACCHO had a grant opportunity for those who worked in public health for some cross training. So I took advantage of that, studied for about 6 months, took the CIC, and then got my very first job right after I passed the test. So I think it was really helpful for me in my career. Very first infection prevention job.
I think that's great to hear the value of certification being kind of emphasized here. I think that's something that our new IPs that are listening or people that maybe want to go into the role of IP, it's important for them to hear that because sometimes people will find themselves questioning, like, why get certified? What's the value of certification? So if you can just kind of touch a little bit more on that, like what really made you see that certification is the way that I want to go, especially afterwards when it's like, okay, that helped me get my job.
That is a really good question, and I'm glad that you asked that, because so while I was studying for the CIC and I had it scheduled, you have to take it within 90 days of scheduling it, I actually had 2 job interviews with different hospitals, and nobody took me seriously. They're like, you've never done this job before. What makes you think you can come in and do our job with no experience? And it didn't matter that I had just talked all about the decade I'd spent in public health doing infectious disease, or the master's I have in epidemiology. That's I've been working in this field for 10 years, and they didn't translate to these people, to these groups. They really were used to seeing clinicians and not MPH students or epidemiologists. And I felt like in order to break that glass ceiling, I needed to pass a really hard test and get the certification to prove to them that, hey, this can be done. You should give people who are from different backgrounds this opportunity, because we have a lot of knowledge, and often different from our clinicians, that we can bring to the table. And just today, I'm working with my staff at one of my hospitals. We're trying to roll out tuberculosis. Well, I know full well, having worked in public health as an epidemiologist, how that can very quickly turn into an outbreak if you're not treating all the family members. And maybe people in the hospital, they see one patient, they don't think about that public health aspect of it. So I have some strong connections with my public health, allies in my county. So I know who to reach out to and what protocols to put into place and how to contain something like this. So it's really important that public health and infection preventionists in hospitals work together.
It's such a great point. And as a non-nurse myself, and Garrett's a non-nurse, we totally understand. And I think this touches kind of a place deep in our heart, that we're all still fighting our way through proving ourselves every day. And even though we continue to inch closer to showing people that this field is stronger with the diverse backgrounds of everybody, you still are having to kind of prove that your background should be celebrated. That is something I wholeheartedly believe in. So thank you for sharing that.
Oh, 100%. And that's like that kind of tearing down of, I don't want to call it gatekeeping, but it can feel that way a little bit, is a very important part of where IP is going, because having a nursing background is a phenomenal credential to work in infection prevention. But there's also, sterile processing, emergency medicine like Jill, and epidemiology. And, I would even like to see more people coming from an EVS background stepping into these roles, because that's such a specialized area of knowledge. And that the nice thing about that certification is it becomes the funnel of like, okay, I have validity in my field and I know what I'm doing. And I know for me, I took and thankfully passed the CIC here just about a few weeks ago. And one thing that was helpful is there were so many questions about sterile processing on there. And that was, my background. But I'm guessing when you took your exam, Trena, that those epidemiology questions that people can really struggle with was second nature.
That was no problem.
Yeah.
The sterile processing was not my forte. So we each have our own strengths, and it's good to bring your background, like you mentioned, for sure.
I think everybody has that part of the CIC exam that they're like, okay, I got that part. And I tell people, I don't dwell on the part that you got. But most of us have to study a little bit more on the occupational health part, because we probably didn't come into this job doing that. Sterile processing, except for Garrett, is usually something people have to study a little bit more for. So it's kind of like prioritizing where you focus your energy when you're studying for that CIC, because there are so many sections. And so if you're listening to this and you think you might take the CIC, don't be overwhelmed. But as you start to feel like you've mastered a section, move on and don't keep stressing about that section, because your energy will be best spent elsewhere.
Yeah. That's absolutely right. And now I want to kind of put an exclamation mark on one of the things you said, which is the community perspective. So we know that what's happening in our communities is happening in our hospitals, and what happens in our hospitals happens in our communities. So what lens do you look at with your background that makes your roles in IP different?
That's a good question. And I've thought about this as well. So I'm coming in and I'm like, what's an IFU? And I don't know what a trophon is. And the clinical side of things were really a struggle. So sometimes trying to communicate, like infection control and prevention is going to be the same steps, really, like that you would take inside or outside of a hospital. Like there's like the same things that just, there's like some similarities, right? So once you get the language down and you can be communicating and saying the same thing, you kind of get an understanding of, okay, so this is what they know, and you can discuss what you know, and this is how we can solve the problem. And because like a lot of the nurses I have worked with do not have any knowledge of infectious disease prevention and control. So I have that expertise, and I know a whole lot about the pathogens themselves. So I can say, these are the controls we need to put into place, and then ask them, what equipment and what are we using? What's in the environment that, I'm bringing my EVS. What do we need to disinfect? And what's our IFU for it? And we can work together as a team when we have like an incident. Like my very first day, we had a water leak in the OR supply room. And I'm like, oh, really? Oh. Are you serious? So it was like an orientation, and we had a leak in the OR supply room. And I was like, what do I do? So, and I know the basics. I'm like, okay, get rid of anything that got contaminated. And then, okay, they were building the containment. And since I had already taken the CIC, I kind of knew some of the things, but I had a mentor I could call, luckily, because it was day one. So, yeah.
That mentorship piece is super important, especially with this season where we're talking about the IP orientation journey. And we cannot overstate how important it is to find a mentor, to find somebody through LinkedIn, find somebody through your local APIC chapter, hospitals are not competitors in the IP sense. Call somebody at another hospital down the road. And I think that's one of the things that's kind of impressive about the resume is that and it sounds like you've set goals and you've tracked kind of your progress as a new IP. Why does that make a difference when you're in this career?
I feel like there's so much to learn. It can get really overwhelming. So when I was studying for the CIC and applying for a position as an IP, I noted it seemed like people were recommending, the recommendation was to have a 5-year plan and to think about what you would specialize in. So after speaking with you and Jill, I know Jill just got her CRCST, and you do, or like that was like last year, right? And then Garrett, you came from the SBD department. And then we had a number of surgical site infections at my facility that RCAs we had like no like findings on us. And I'm like, as an epidemiologist, like these are supposed to be pretty rare. There's got to be some commonality here, but the procedures aren't the same and the pathogens aren't the same. And it was the same type of surgery. And so I wanted to do a little bit like I know in the back of my mind, I needed to pick an area where I was going to specialize in because that was recommended. And I'm like, yeah, boom, that's it. So I've been working on rounding more in our SBD and our OR teams. And I'm like, not even just once a month. I'm going in every single week. And I'm talking to people about the CRCST. Haven't gotten my leadership 100% on board with it yet because it's 400 hours. And I'm still trying to figure out, and maybe you could give me mentor me a little bit, like, how do you get that done when that is not your primary, like you don't primarily work in the SBD? And just like, if I do an hour every week, that's going to take like 4 years really. But I have a passion for it. And I feel like this is the correct certification to get, so speaking to other IPs. And I think it's really, really important because it like affects the rest of the hospital. If you don't have your SBD and your OR teams like on point. Our biggest amount of patients that we have are for orthopedic surgeries, both inpatient and outpatient. And if we start seeing an increase in infections, well, that's our reputation. And we want to make sure at least I do, that I know what's going on and that I know what's happening in those departments, and I'm just struggling to understand because there's a lot to know. So I'm working really hard at building my knowledge and working with my teams to get me up to speed. And how do I find this information?
Well, I couldn't be happier that you brought up the CRCST for IPs, because I think it's so important. I talk to people all the time about it because it really is just a great experience going through the preparation, because you're working directly with someone in SPD. You're allowing them to teach us, which is such a great kind of role reversal. We're not going in there and saying, okay, do this different, and we're going to teach you. We're allowing them to be the teacher, which just helps form such a great relationship. The 400 hours does seem daunting, and I tell people this all the time, like, don't let it scare you, because you just have to start documenting your hours somewhere, because you're already going in there, so you're already getting hours. But if you don't start documenting them now, then you're losing those hours. And there are different sections of SPD. You have to have a certain amount of hours in. So I would go ahead and pull like the application so you know. But, it took me a couple years to get the hours, but you're already doing a lot of the work that you need to do for the certification. You just have to start tracking it. So I think that's how you can kind of spin it to your leadership is, I want to start tracking my work for this certification. A lot of it I'm already doing, but I may need to spend a little bit of extra time in there to actually do a little bit more hands-on. But in the end, it just gives you more understanding of how their work is, because you'll now know. You won't just be watching them at the decon sync. You'll know how to do it. And there is so much benefit for an IP to know that. And then when you walk in there and you say, I have my CRCST, the way that they're happy for you, the respect that they have for you, just because you want to be part of their world so much that you went through all of this, it's a game changer.
It really is. I can speak from experience. When you have an IP that comes in and they want to learn, if the only time we see IP is when they're there to audit or, do a mock, survey or a tracer, then everybody kind of, hides the dust bunnies and, there's a lot of places in SPD to hide things. So getting in the department and being able to have that relationship with leaders there and frontline staff is incredible. I think the other really huge benefit is, and maybe I'm biased, I certainly am biased, but I find SPD in the process focus to be kind of a gold standard for other areas of the department. If we don't clean something appropriately in SPD, there's a lot of checks and balances. But if it doesn't happen with a glucometer on an inpatient unit, there's not nearly the number of checks and balances. So when we can have that really good cleaning, disinfection, sterilization hat on, that's transferable to tons of other departments. Now, in your role as a IP manager, you've also had a role in mentoring and helping new IPs develop their skills, develop their goals. What's that experience been like for you?
So I don't have an IP mentor per se, but so I went to the Colorado School of Public Health for my MPH, and I remember how difficult it was being a graduate student trying to find a capstone project, because it is intense how much work you need to do on just that project alone in order to graduate. So I've reached out to the School of Public Health and I said, send me a student that's looking for a project, and I've connected them with a project and I mentored them, and that was helping me pay it back. And it also was one less person that was like, what do I do and how do you navigate this, that I could mentor and help, and I like helping people. So I just caught up with her. I guess it was a few months ago after she graduated and she was looking for a job, and we discussed areas that she wanted to move in, and I had just become an infection preventionist, and I was talking all about how interesting this job is, and it's something that's an option which she hadn't thought of before. And so we worked on resume and job interview skills, and then she found a job pretty shortly after. So that was really great. So, and then eventually I'd like to mentor an IP that actually is in that role. But I don't have one yet because I'm still one of the newer people. I've been with my team for about 15, 16 months. So
I think that's so important to partner with the local MPH schools. It's something that we've been doing for several years now too. And letting them know, like, hey, IP is a field that you can go into. Did you know that? Here's what IP is. And we started doing a whole presentation on it for the epidemiology track classes. And then we say, you know what, if you need to do a capstone project, kind of like you did, but to a wider audience, and saying if you need your internship, your capstone project, we'd be happy to have you. And that is us also helping secure the next generation of IPs, which I feel like we all kind of have a responsibility to do. And no, they're not in a specific program for infection prevention, but they very easily can slide into an IP job. And sometimes they don't even know it's out there. Like you said, like, oh, I didn't even think about that kind of career. I certainly didn't think about this career when I was in college. So I think that's so great to be proactive about reaching out to these students and not waiting on them to come to us.
Yeah. And having that established dynamic, it just creates a pipeline. Job shortages that's healthcare wide, but IP especially. I think there's, IPs retiring every day. There's not new IPs coming in and then staying in. I think that first year is incredibly challenging as a new IP because it feels like you're drinking from a fire hose.
Exactly what my boss told me, like day one. And then I was like, stop saying that. And when does it get better? It's true. It's really true.
Yeah. Jill, when does it get better?
Well.
Oh, no. Bad news on that.
I feel like it's gotten it better, but it did take about a year.
I think it has its moments where you feel like, okay, I've got this today. And then by the afternoon, you feel like you don't got this anymore because everything came crashing down.
That's a very real thing. And that whole concept of, it's come up a couple times this season already, is that feeling of like being new and kind of that imposter syndrome of feeling like I'm in a leadership role. I'm kind of expected to know if I make a bad judgment call, whether it's doing surveillance or whether it's making a bad recommendation, it can have a huge impact on your credibility. And so how have you found to address that imposter syndrome?
It's taken me a minute. It's gone from I just want to hide in my office to talking to my fellow IPs about this. I was like, I feel like I don't have the trust and the respect, and I'm not the established. I come from being a subject matter expert where I was my team's go-to person in my previous role, and now I'm like, I don't know what Trophon is, so people aren't really talking to me. So I'm like, I'm going to hide some days, but I went to my local APIC chapter and I started chatting with other people outside of my organization. What are you doing? And they're like, well, no one's listening to us either. And it's like, you've been doing this for 5 years. Really? And so collaboratively, what we discussed during our conference last fall at my local chapter was you really just need to remember to be vulnerable. So I'm a type A, neat perfectionist, need to know all the answers kind of person at times. And it's been really difficult to put myself in sometimes forced, positions where I'm like, I don't know everything, and be vulnerable and still hope that people can come to me as a subject matter expert and trust me. But I think I've grown a lot in my career by doing that. So I'm going into SBD not once a month when I forget by the next month, but I'm going in every week and I'm working with the same people, and I've built rapport with these guys, learning the basics, and they're really excited about me wanting to take the CRCST, and then I'm interested in what they're interested in, and we're sharing what we know with each other. And so that's been lovely, but it took me a lot of vulnerability and, trying to set aside my wanting to know everything to try to really learn, and who best to learn from than your colleagues who are experts in these areas, because as an IP, you're working with all of the units, all these different units, and they all have different specialties and things that, IFUs and like equipment that you maybe don't know. It's hard to know everything. So it's really important to try to get in and round with your people, or even do a job shadow. Like I'm trying to do an pretty extensive job shadow with SPD and focus on that area. And it's only helped me in my role as an infection preventionist. Oh, this group is seeing wound dehiscence from this suture. And are we seeing that here? And do we use this? And I would need to know what that is, and let's follow up on that. That's something I'm currently following up on. Is this something that we're seeing at our hospital? They're having surgical site infections over here. Are we seeing that at our facility? Let's see if there's something we can collaborate on and make sure that that's not going to be something that's an issue for us. So
I love that you focus on vulnerability. That was one piece of advice that I was given years ago. And one of the authors that I was told to really read is Brené Brown. I don't know if you've ever heard of her, but she really talks about vulnerability. And so I think I've read almost every one of her books by now, but it is really so important. And as IPs, it is hard for us sometimes to walk into a room and be like, wow, I have no idea what I'm looking at. So can somebody help me? But that is how we learn. And we do have to put pride aside for a minute, because if we don't do that, then we're going to say something wrong. We're going to look at something wrong. In the end, it's just going to hurt us. It's going to hurt you as the IP. If you don't say, hey, can you teach me this? I don't know. You don't have to say, oh, I'm new to IP. You just have to say, hey, can you teach me more about this? I've never seen it before. And putting down those walls, and because hopefully people will do that to you too. Like, hey, I've never seen this organism before. Can you tell me why we're isolating or whatever? And people kind of give you the energy back that you're giving them.
Yeah, that's 100% true. Because if we try to map out every single detail as IP, and I've done it before and done it wrong, where I've said, okay, this is exactly what you need to do, and this is the steps you need to take. And then, the person who's actually doing the work, it comes back and says, this is all wrong, and these are the reasons why. And then you have to take a step back. And so it's a shift in approach to say, like, all right, I'm going to let you design the workflow, this is the goal. The IP is going to say, this is the end result, and however we get there in a compliant way, and then we can provide feedback and be almost more of a support. And it sounds like you've had that dynamic with your units and in your process.
And some days, like, you feel like you're rocking it, and I got that right, and I know what I'm doing, and then the very next day, there's a bedbug outbreak, and you're just like, why did nobody call me on the weekend? And I'm like, oh boy, this is fun.
It reminds me of like when people say, what is the typical day? And I'm like, oh, God, there is no typical day. And that is so true for new IPs too. Like, don't think that, oh, my days are going to all be the same. I'm going to get all of my work done the same way every day, because it's almost never going to happen like that. You're always going to have that emergency or that OR water leak or, whatever urgent thing happen that's going to totally derail your day. And sometimes that's really hard for newer IPs to get used to, not just like the not getting your work done in the way you want, but just like the constant changing of your schedule and changing of your direction. And then you get to the end of the day and you're like, oh my gosh, I never got all my things done. But that is the life of the IP. And sometimes it just takes a little bit of getting used to that. This is how we roll.
But who doesn't enjoy a challenge, really? Because I'm not somebody, like, I've got multiple degrees and I've switched fields like entirely. And, everything kind of has got me to this point. Like, I have an education background in public health as well. And I feel like all roads have led to this. I've been circling around it for a while, and I can use all the skills and the tools that I have acquired. And I get, I get bored. You kind of get like lazy. So I like the challenge, and I like no 2 days are alike, and you don't always know what to expect, and you got to think on your feet. And even if you don't feel like super confident in the beginning, you will eventually, you keep at it, you will eventually have answers more quickly at your, you've experienced that before, and it won't be, I'm not quite sure how to answer your question or how to handle this. Let me do my research. You know where your resources are, so it might take you a minute to think about it, but you will have the tools that you need. But it will come quicker the more situations that you're in, and if you keep being vulnerable and learning from your colleagues and just keep going. And it's a really fun field, and I would encourage anybody who is interested in the field of infection prevention to contact myself or you guys. I met you all through LinkedIn, and it's the infection prevention community has been the most welcoming, kindest group of people I have. I've worked in many different fields, and everybody has been so great and so helpful, and the passion that I see in this group is like phenomenal. And I think I've finally found my people. So I know I probably said that before, but I really love working.
I love that. And I think we all just kind of share this bond because you know that even when you're sitting there on a Friday afternoon and everything is just falling apart, you know you're not alone because somebody else is doing the same thing all over the country, all over the world. And then we just share this kind of camaraderie because we all get each other.
We love living in the chaos.
Yeah.
Living in the chaos. Yep. And I think that's such an important reminder. And as we close out, I love that call to, give yourself grace to learn, grace to do your research, and give yourself time to, get equipped with the knowledge. So, Trent, as we close out today, can you give us one or two really good go and do's for new IPs during their orientation journey?
So you should definitely connect with people who work in the field. So I use LinkedIn to connect with infection preventionists. I just started reaching out to them and saying, hey, I'm really interested in this field. Would you connect with me? Would you be willing to have a discussion? I also then went and joined my local APEC chapter as a student. I think it was fairly inexpensive. And I started networking with people who worked and lived in my area. And I talked to them about job shadowing and what they do and why they like what they're doing to get a better idea of, one, how to pass the CIC, and two, what the actual job would be like, because I hadn't done it before. So those would be my top two takeaways or like go and do's.
Well, thank you so much. Those are excellent, actionable things that we can take and work into our daily work or getting into this field. So, Trena, I just want to thank you for your experience and your insights and joining us today on the podcast. Thank you.
Thank you. I enjoyed being here.
All I have to say is, wow, that was so much fun. I feel like that 30 minutes just kind of flew by. And then I realized I wasn't even taking notes. I wasn't writing anything down because I was just having such a good time talking. And I just loved the conversation. And I think I could have done that for like 3 hours. The one thing that really stuck out to me, and probably because I love reading about it and it was so important to me, is the power of vulnerability. And I love that Trena brought this up because it is so important just to let your walls down, be vulnerable, walk into sterile processing or walk into endoscopy, wherever you need to learn more about, and just say, can I watch you? Can I learn from you? Because as IPs, we are always learning and we can form relationships with people just by being vulnerable. So I love that she brought that point up.
I did too. And it's fun because one of the awesome things about this podcast is you get to hear people's real life experience. It's webinars are great where it's very formal, but we also really like hearing like, hey, I came into this field. I struggled with this. I struggled during the interview process. And I wrote that word vulnerability down as well. I think that's a really neat takeaway because it's hard out there. And that knack of leading with vulnerability is something we can all apply. So, Jill, thank you so much. Trena, thank you so much for a wonderful episode. And remember, infection stops where information starts.
Thanks for tuning in to the Transmission Control Podcast, where infection stops because information starts. If you enjoyed this episode, let us know. Connect with us on LinkedIn, Facebook, or wherever you get your podcasts. Don't forget to leave a 5-star rating and share this episode with your team. Until next time, stay informed, stay vigilant, and keep transmission under control.